Dr. Bennett wanted to know about my opinion about changes in the insurance industry. Well, Dr. Bennett, I know you're here, and I'm going to open up the mic and let you talk. But you don't want to know my opinion. You want to know, let me show you just, you want to know this guy's opinion. Dr. Bennett, I'm going to unmute you. Dr. Bennett, are you there? Dr. Bennett?
Yeah, I'm here.
Okay. You asked me about my opinion about Obamacare and the insurance industry.
Yeah, absolutely.
Okay. You don't want my opinion. You want this guy's opinion. Can you see the computer?
I sure do. I see John Oxendine on
And
there.
you know who that is?
Yeah, he used to be the commissioner of insurance for the state of
Eh,
Georgia.
for 16 years, he was commissioner of insurance. And what he does now, well, he does a lot of things, but his specialty is representing doctors who practice this type of medicine. And he goes after insurance companies and he helps you to understand what your rights are. We had a business of medicine seminar, I don't know, sometime in the summer, and he came and spoke. He was supposed to speak for an hour. He spoke for about 4 hours, and he was the most important person in that seminar. What I had to talk about was nothing, but he talks about how doctors are afraid of their own shadow when it comes to insurance companies, and they don't really utilize their rights to get paid for legitimate medical services. And if you didn't come to hear anybody else, you need to come and hear him. And he's also a expert on the Affordable Care Act, and he thinks that the Affordable Care Act is going to be very favorable to doctors who practice functional medicine. And he is a Republican, and he says that the Affordable Care Act is actually positive for physicians. And
Glad
he
to hear it.
talked about that at the Business of Medicine seminar. So if you want to understand how the Affordable Care Act is going to affect you, this is the guy who you need to talk to. And if you're having trouble with getting paid for uh, things that you do, you call him. And we have him on retainer. Several other eye doctors have him on retainer. And sometimes just a letter sent to the right person with the right signature on the bottom will solve a lot of your problems. Okay, so I'm not. The two opinions I'll give you: the Affordable Care Act. If you practice functional medicine, it's probably going to be a lot more positives than negatives involved. And if you're worried or having problems with being paid by insurance companies, he knows who letters need to go to. He can tell you things on your intake sheet, certain wording that you put on there where the patient gives you their rights, because the patients have a lot more rights with insurance companies than you do, but the patient can assign their rights, the patient's right, to you, and you have the right to demand payment just like the patient has the right to demand payment. But you have to have certain wording that allows that to happen, and then it greatly increases your leverage with the insurance company. Okay,
Great.
so so we try to cover all bases, and in order for you to practice functional medicine, you've got to know your rights, and you've got to be able to pay for legitimate services that should be paid for. So that's why we have John Oxidine there. It's great to understand organic acid and all of those, but if and you can tell by what Dr. Lord said, those are legitimate services, and you should be paid for those. You should be paid for those services. So yeah, so I know you're already signed up, Dr. Bennett, but if that's your question, uh, you that's the person you want to make sure you don't miss.